Robert had chosen ambulance work to help save lives after years of investigating medical crimes that destroyed them. But when he realized doctors were harvesting organs from living patients, he knew that some fights never end, no matter how much you want peace. I wonder where you're watching this story from today. Whether you're in a major city with world-class hospitals or a smaller community with local medical centers, you've probably seen them. Ambulance drivers racing through traffic, transporting patients during their most critical moments. But how often do we consider what expertise these emergency responders might possess beyond their knowledge of streets and medical protocols? Today's story will change how you see the people who bridge the gap between crisis and care. Robert Chen had been driving ambulances for Denver General Hospital for 10 years. At 64, he possessed the calm demeanor and quick reflexes that made him invaluable during medical emergencies. He knew every shortcut through the city, every hospital protocol, and every second-saving technique that could mean the difference between life and death for critical patients. Medical staff appreciated Robert's reliability and professionalism. He never panicked during crisis situations, maintained perfect safety records despite high-speed emergency runs, and had earned the trust of doctors and nurses who depended on his expertise to get patients to life-saving treatments. Fellow ambulance drivers respected Robert's knowledge and mentorship. He trained new drivers, shared insights about patient care during transport, and maintained the kind of steady competence that made him a preferred partner for the most challenging medical emergencies. To colleagues and patients, Robert appeared to be exactly what he seemed: a dedicated emergency medical services professional who understood that ambulance work was about more than transportation. It was about providing critical care during the most vulnerable moments of human experience. But Robert's understanding of medical systems and patient care went far beyond what was required for ambulance driving. Before Robert became an ambulance driver, he had spent 20 years as Dr. Robert Chen, medical ethics investigator for the Colorado State Medical Board. He had investigated physician misconduct, medical fraud, and institutional violations that put patient safety at risk. Dr. Chen had specialized in cases involving organ transplantation, end-of-life care, and medical procedures where ethical violations could result in patient death. He understood medical billing systems, transplant protocols, and the complex regulatory frameworks designed to protect patients from exploitation by unscrupulous medical professionals. Robert's expertise had focused on identifying patterns of medical abuse, how corrupt physicians manipulated patient records, bypassed safety protocols, and exploited vulnerable patients for financial gain. His investigations had resulted in medical license revocations, criminal prosecutions, and systematic reforms that improved patient protection across Colorado's healthcare system. But 20 years of investigating medical crimes had taken a profound psychological toll. Robert had seen too many cases where patients trusted medical professionals who betrayed that trust for money, witnessed too many situations where institutional failures enabled systematic abuse, and carried too many investigations where interventions came too late to prevent patient deaths. When he reached retirement eligibility, Robert had chosen to leave medical investigation work entirely. He wanted to contribute to healthcare in ways that focused on saving lives rather than investigating how they had been destroyed by medical misconduct. Ambulance driving offered what seemed like the perfect transition: work that utilized his medical knowledge while providing direct patient care without the emotional trauma of investigating medical crimes. For 10 years, Robert had successfully maintained this focus on life-saving rather than crime-solving. He transported patients, supported medical teams, and avoided thinking about the systemic problems that had once consumed his professional attention. But some knowledge never disappears, and some instincts never stop working. It began 6 months ago with observations that Robert initially tried to rationalize as coincidences. Certain organ transport runs were exhibiting irregularities that triggered his dormant investigative instincts. Irregularities that suggested systematic violations of medical ethics and transplant protocols. The first pattern involved timing and documentation. Robert noticed that specific organ transports were being scheduled during off hours when fewer administrators and oversight personnel were present in hospitals. These runs often involved paperwork that seemed rushed, incomplete, or processed through unofficial channels. The second pattern concerned patient conditions and medical records. Robert observed organ donors whose medical histories didn't match their stated conditions. Patients whose recovery prognosis seemed inconsistent with their transplant eligibility, and cases where family consent documentation appeared questionable or missing entirely. The third pattern was the most troubling: behavioral anomalies among medical staff involved in these transport operations. Doctors and nurses exhibited nervousness, avoided standard communication protocols, and demonstrated the kind of secretive coordination that Robert associated with medical misconduct cases. Robert's 20 years of medical ethics investigation told him he was witnessing systematic organ harvesting that violated federal regulations, medical ethics standards, and fundamental patient rights. Robert faced a complex moral conflict that tested his desire for peaceful retirement against his professional obligation to protect patients from medical exploitation. His experience investigating organ trafficking cases told him that delays in intervention could result in additional patient deaths. But reporting his suspicions would drag Robert back into the world of medical crime investigation that he had worked so hard to escape. It would require him to testify in legal proceedings, endure professional scrutiny, and potentially face retaliation from powerful medical institutions. More troubling was Robert's realization that his position as ambulance driver provided him with unique access to evidence that would normally be invisible to regulatory authorities. His transportation duties gave him opportunities to observe patterns, document irregularities, and gather intelligence that could be crucial for exposing systematic medical crimes. Robert began documenting his observations with the systematic precision he had once used for formal medical ethics investigations. Despite his reluctance to become involved in criminal investigations, Robert found himself automatically cataloging suspicious activities with a methodical approach that had once made him one of Colorado's most effective medical fraud investigators. Robert maintained detailed records of questionable organ transports, including patient information, medical staff involved, timing irregularities, and documentation problems. His notes followed investigative standards because his training had made such precision automatic. Most importantly, Robert began recognizing the operational structure of what appeared to be a sophisticated organ trafficking network. He identified medical professionals who seemed to be coordinating illegal transplant activities, administrative staff who were processing fraudulent paperwork, and financial patterns that suggested systematic exploitation of organ transplant systems. The network's sophistication suggested involvement by highly trained medical professionals, significant financial resources, and institutional protection that allowed illegal operations to continue without detection by regular oversight mechanisms. The organ trafficking operation escalated in ways that confirmed Robert's worst suspicions about its scope and systematic nature. Instead of isolated cases of medical misconduct, Robert observed coordinated harvesting of organs from patients who appeared to be deliberately placed in life-threatening situations. Robert witnessed transport runs where patients were being moved not for life-saving treatments, but for organ extraction procedures that would result in their deaths. His medical knowledge allowed him to recognize when patient conditions were being manipulated to justify organ removal. Most disturbing were cases involving patients who appeared to be conscious and aware during transport, suggesting they were being moved for organ harvesting while still alive and capable of recovery with proper medical treatment. Robert's professional training and moral conscience demanded intervention before additional patients were killed for their organs. On a Tuesday evening in October, Robert received a transport request that would force him to choose between his personal safety and his obligation to protect patients. He was assigned to move a patient from Denver General to a private surgical facility that was not authorized for organ transplant procedures. The patient, Maria Santos, was a 34-year-old woman who had been admitted for routine surgery but was now being transferred for emergency organ donation, despite medical records indicating she was expected to make a full recovery. Robert's medical ethics background immediately identified this as an illegal organ harvesting situation where a patient was being transported for execution disguised as medical treatment. Robert realized he was facing the same moral choice that had defined his investigative career: whether to intervene when intervention carried personal risk or remain passive while vulnerable people were killed by medical criminals. Robert made a decision based on 20 years of experience protecting patients from medical exploitation. Instead of driving to the requested surgical facility, he began taking a route that would provide opportunities for intervention while maintaining the appearance of normal medical transport. Robert activated his ambulance's emergency communication system while engaging the accompanying medical staff in conversations designed to gather evidence and assess the immediate threat to the patient. "What's the patient's current condition?" Robert asked the attending physician, Dr. Michael Harrison, noting inconsistencies between the patient's apparent health and her supposed need for emergency organ donation. Dr. Harrison's responses followed scripted patterns that Robert recognized from previous medical fraud cases. While the patient's vital signs indicated she was stable and not facing life-threatening organ failure, Robert began varying his route to past police stations, regulatory offices, and other locations where help might be available if the situation required immediate intervention. When Robert realized the destination was a surgical facility with known connections to illegal organ trafficking, he made the tactical decision to directly intervene rather than deliver a patient to certain death. Robert pulled over at Denver General's emergency entrance, claiming the patient was experiencing complications that required immediate evaluation by hospital staff not involved in the organ transport. As Dr. Harrison became agitated and demanded continuation of the transfer, Robert sent a coded emergency message to hospital administration using protocols he remembered from his medical ethics investigation work. "I need immediate consultation with Medical Ethics Review Board," Robert transmitted. Possible violation of organ transplant protocols requiring urgent intervention. Dr. Harrison attempted to override Robert's concerns, but Robert had positioned the ambulance where hospital security could observe the situation while he protected the patient from being removed for illegal surgery. Hospital administrators responded to Robert's alert with the coordinated efficiency of medical professionals trained in ethics violation protocols. Dr. Sarah Martinez, Chief of Medical Ethics, arrived with security personnel and regulatory specialists trained in organ transplant oversight. The driver reports possible organ harvesting violations, Dr. Martinez observed as she approached the ambulance. "What's your assessment of the situation?" Robert provided a comprehensive briefing that impressed medical administrators with its precision and professional quality. "The patient shows no signs of organ failure requiring emergency donation. The paperwork bypasses standard consent protocols. The destination facility is not authorized for organ transplant procedures." Dr. Martinez checked Robert's background and discovered his medical ethics investigation history. "Dr. Chen, your organ trafficking cases set precedents for patient protection protocols. What brought you to ambulance driving?" Robert explained his transition from medical investigation to patient transport while maintaining focus on the immediate situation requiring intervention. Robert's intervention led to the arrest of Dr. Michael Harrison and 6 other medical professionals involved in systematic organ harvesting operations. Maria Santos was returned to appropriate medical care and made a complete recovery from her original condition. Robert's professional analysis of the organ trafficking network provided investigators with detailed evidence about medical protocols, financial systems, and institutional failures that enabled illegal organ harvesting to continue undetected. The investigation revealed that medical facilities throughout Colorado had been infiltrated by criminal organizations seeking to exploit organ transplant systems for illegal profit while murdering patients whose organs were valuable. Robert agreed to serve as a consultant during the investigation, providing expertise about medical ethics violations while maintaining his ambulance driving duties to continue gathering intelligence about healthcare crimes. The investigation expanded beyond the single case Robert had prevented. His intelligence led to the identification of an organ trafficking network that operated across multiple states, using legitimate medical facilities as cover for systematic patient murder and organ theft. Federal agencies joined the investigation as evidence revealed connections to international organ trafficking organizations and operations spanning dozens of hospitals. Robert's expertise proved valuable not only for the Colorado case, but for understanding how trafficking networks exploited medical systems nationwide. The multi-agency operation resulted in 89 arrests, prevented hundreds of additional patient murders, and led to systematic reforms in organ transplant oversight that protected patients across the healthcare system. Robert received awards from the American Medical Association, organ donor advocacy organizations, and federal law enforcement agencies for his role in exposing the criminal network. But he valued most the letter he received from Maria Santos after her recovery. "You saved my life when doctors I trusted were planning to kill me," Maria wrote. "Thank you for seeing that something was wrong when everyone else thought it was normal medical procedure." The case became a landmark example for medical ethics education, demonstrating how healthcare professionals with investigative backgrounds could serve as crucial protectors of patient rights and safety. Robert's success led to the creation of the Medical Ethics Alert Network, a program that trained ambulance drivers, nurses, and other healthcare workers to recognize signs of medical misconduct and report violations to appropriate authorities. Robert continued driving his ambulance while serving as a consultant for medical ethics investigations and training other healthcare workers in violation recognition and reporting protocols. His dual role allowed him to use his expertise while maintaining the direct patient care work that provided emotional satisfaction. The program expanded to include former medical investigators, ethics specialists, and regulatory professionals whose backgrounds provided valuable capabilities for identifying and preventing medical crimes. Robert's work led to significant changes in how medical facilities approach organ transplant oversight and patient protection. Training programs were developed to help healthcare workers recognize signs of medical misconduct, understand reporting procedures, and safely assist patients without putting themselves at risk. Hospitals implemented protocols that required multiple approvals for organ transport procedures, enhanced documentation requirements for transplant eligibility, and systematic monitoring of organ donation patterns that could indicate illegal harvesting operations. Most importantly, Robert's intervention demonstrated that medical crimes could be identified and prevented through the observational capabilities of experienced professionals working in patient transport and direct care roles. Robert found that his role as medical ethics consultant provided the satisfaction of protecting patients without the institutional politics and bureaucratic challenges of formal medical investigation work. He could use his expertise proactively to prevent crimes rather than just investigating them after patients had already been harmed. The integration of his medical ethics knowledge with his ambulance driving duties created a unique form of healthcare service that addressed both patient transport needs and safety protection simultaneously. Robert's work demonstrated that retirement from medical investigation doesn't necessarily mean abandoning the skills, dedication, and protective instincts that define professional patient advocates. Robert's interventions have protected not only direct victims of organ trafficking, but entire healthcare communities that were being exploited by criminal medical networks. His work removed corrupt physicians from patient care, disrupted illegal operations, and made medical facilities safer for vulnerable patients. The training programs Robert developed have been implemented across the healthcare industry, creating systematic approaches to medical misconduct identification that operate continuously throughout medical facilities where patient exploitation is most likely to occur. Robert's success proved that patient protection depends not just on official regulatory oversight, but also on the observational capabilities and ethical commitment of experienced professionals working in direct patient care roles. Today, Robert Chen continues serving Denver residents as both ambulance driver and medical ethics specialist, protecting vulnerable patients through his daily transport duties while maintaining vigilance against medical crimes that exploit healthcare systems. His routes have become some of the safest for patients requiring emergency transport, not because of increased regulatory presence, but because of the expertise and dedication of a driver who understands that medical work serves both healing and protection purposes. Robert's mission has expanded beyond organ trafficking to include identification of medical fraud, patient abuse, and various forms of healthcare exploitation that target individuals during their most vulnerable medical moments. Robert's story illustrates how professional expertise developed in medical ethics investigation can be repurposed to serve patient protection needs while providing meaningful civilian healthcare employment for retired investigators. The principle applies beyond organ trafficking cases. Former medical investigators possess skills in pattern recognition, regulatory knowledge, and misconduct identification that can be valuable in numerous healthcare contexts where patient safety intersects with potential exploitation. Robert's success came from recognizing that his medical ethics training could serve patient protection needs in ways that traditional healthcare employment structures hadn't considered, creating innovative approaches to medical crime prevention. Robert Chen represents hundreds of former medical investigators who continue serving their communities after official retirement, using their expertise in creative ways that address ongoing patient protection challenges within healthcare systems. These individuals create protective networks that operate through ordinary medical activities, providing intervention capabilities that patients benefit from without necessarily recognizing the specialized knowledge that makes such protection possible. Robert's ambulance became a mobile patient advocacy unit. His transport shifts became medical ethics patrols, and his patient interactions became opportunities to identify and prevent medical crimes. We are watching this story from today, whether you're near a major medical center or a smaller healthcare facility. Consider that the medical professionals around you might possess expertise that protects vulnerable patients in ways you never notice. Behind their medical duties might be training, experience, and dedication that creates safety networks you benefit from without realizing the sophisticated knowledge that makes such protection possible. Robert Chen spent 10 years trying to separate his medical ethics expertise from his patient transport work, believing that retirement meant leaving medical investigations behind. But when he recognized that criminals were using medical facilities to murder patients for organ theft, he discovered that true healthcare service means protecting others regardless of official roles or personal preferences. If you found Robert's story of medical vigilance compelling, subscribe to Everyday Life Stories for more accounts of the extraordinary expertise hiding behind ordinary healthcare job descriptions. Sometimes the most important protection comes from the most unexpected medical guardians, watching over us during our most vulnerable moments. The real heroes don't always wear white coats or work in administrative offices. Sometimes they wear ambulance uniforms and drive emergency vehicles, protecting patients one transport at a time.